I'm joined now by the senior Congress leader, Milind Deora, who's with us. Milind, thanks very much for being with us this evening. Now, you've been tweeting something fairly interesting. You've been talking about the pressing need, in your opinion, to vaccinate not just 45 plus, but as many citizens, adults, as possible. Do you believe that this should have in fact started a few weeks back, because we knew about mutant strains back then?
Well, I believe that the vaccination, the entire vaccination process all over India has certainly, we started a little later than many other countries in the world. I mean, if you look at Israel, for instance, they've achieved a hit rate where every single person in the country has received at least one dose. The United States has crossed about 100 million people. They are vaccinating close to 2.5 million people per day. And I do believe that countries that vaccinate their populations as quickly as possible are the ones who will be able to open up their economy and save more lives and livelihoods. So in that sense, I think that India still has an opportunity. We spent a lot of time, donating vaccines all over the world. Unlike China, whose vaccine diplomacy was about selling vaccines to needy countries, our vaccine diplomacy was one where we donated vaccines to different countries, and I'm fully in favor of that. But I do believe that now, better late than never, it's time we re-energize our focus across the country, but more specifically, because if you look at my last tweet, and if you look at yesterday's numbers, 60% of cases in India, new cases in India, are emanating from Maharashtra.
Yes. And
the top 5 cities, I think, in India are cities in Maharashtra. In Pune, between Pune and Mumbai, for instance, they account together for 22% of national cases across the country. So I believe that if the government of Maharashtra, the local municipalities in these affected cities, state governments in other cities like Delhi and even in some Kerala cities that are affected, and the government of India just focus on these hot zones, really, because these are the same cities, mind you, that were very badly affected in the first wave. So clearly there is a problem in terms of the population density of these cities that is leading to a second COVID surge, as we saw in the first surge. And I think if we re-energize and converge all our efforts and all governments come together, keep politics aside, and ensure that everybody, every adult above the age of 18 is vaccinated as quickly as possible. You do that in many, many ways. One way is certainly to decentralize the vaccine rollout, make it far more accessible and easy for people to, we should get to a system where you can go to your general practitioner, your GP, in congested areas, there are small clinics, and that doctor should be able to administer a COVID vaccine.
And should
obviously
people be
keeping
allowed
certain,
to buy it, Milind?
keeping certain precautions in mind.
There are millions of citizens, Milind, who would say that, look, I understand it's a crisis, I'm willing to pay for it, and therefore let's roll out the availability. It's a disaster at this situation across the world. So what's wrong with people paying for it if they want to? How does that take away from the government's plans of giving it free to those who cannot afford it?
Well, I think paying is something which, if you do it in a private hospital, for instance, somebody can go in and pay for it. If you do it in a government hospital, let's say in Mumbai city, there are government hospitals like Nair, there are government hospitals like JJ.
Rate, right? The rate right
where you
now
can get
is
it free, you can get it at a
If there were many more vaccines available, for example,
hospital,
Pfizer,
for instance,
or
somebody
Moderna,
is willing to pay for it,
and people were willing to pay, then what's wrong with it?
Yeah, I think the question is not who pays for it. I think the government of India has made it abundantly clear several times that they want to provide free vaccines for the citizens of India. So I don't think payment is an issue. But I do believe that the government of India's process of keeping it very centralized, first the first health responders, which is very, very important to do. We support that. Then moving to those above the age of 60 and people above the age of 45 who have comorbidities, now relaxing that and saying anyone above the age of 45, no questions asked. I would say again that if you just pick the top 10 cities in India, many of those are from Maharashtra, and you look at those cities in the second surge, and you compare what happened during the first wave, they are almost the same cities. Mumbai was very badly affected during the first wave. It's very badly, it's one of the highest cities in India today during the second wave. So if the government of India, in partnership with the state governments and the municipalities, puts all its effort into these cities, vaccinates 70, 80, 90% of the population, the adult population, I think then you'll reach a stage where you will have herd immunity. Because mind you, in a city like Mumbai, during the first wave, and I think up until September when India's COVID numbers and curves started to flatten out, there were several serological surveys done by many institutions, private, government, and they determined that in certain slum pockets, which are extremely congested, where people have shared access to a toilet, for instance, 65 to 70% of people had antibodies, which means they've already had COVID, and in some ways they're protected. So it's not going to take many more vaccinations for people in Mumbai to attain herd immunity.
All right.
And my only point is that I'm not saying that we should focus only on Mumbai and leave the rest of the country out. I'm saying that these 10 cities
focus on cities and areas which are affected.
These 10 cities ultimately, look, they're not happening because of failed governance or because the government has the wrong policies. They're happening because they are very densely congested cities.
Correct.
And in the same case, for example, New York. New York was the worst affected city in America because it's a congested city. It's dense, it's packed. And as compared to other parts of the US. So if the government of India, I think, rather than just generalizing and saying we're having this national rollout, which you should do, if they relax it for a city, for states like Maharashtra, allow states to self-determine whether they want to allow those above the age of 18 to get vaccinated, that's something which should be left to state governments, because different states have different dynamics at play. And different states are battling the second surge in a very different way from other states. And you should leave it to local municipalities and states to determine what works.
Fair enough, Milind. I think you've raised an important proposition. Perhaps a lot of us should have actually highlighted some of those points. Thanks so much for being with us.